Hey YouTube, it's Courtney, or VSG Redesign Me, coming at you with my pre-op plastics life update. I had my bariatric surgery, vertical sleeve gastrectomy, on January 7th, 2015 with Dr. Eric Sommer at New York Bariatric Group in Cortland Manor, New York. My highest weight was 345. I currently fluctuate between 200 and 205. I've been sitting like that since January, pretty consistently, with a few minor flaws and upsets, but for the most part that's where I maintain. I hate the word maintain. I decided in April, right before WLSFA, to have my plastic surgery, mostly because I really needed to have my breasts done. I did my skin flick a little while ago, so I'll post this at the end, or that at the end, or in a separate video depending on how long I make this. But my breasts were a big problem. I have grade 3 pertosis. There's a lot of pain in my breasts, a lot of significant sag, so they needed to be done. My surgeon recommended also doing the tummy tuck at the same time, just for cost saving reasons, and so I don't have to pay for the anesthesia twice, blah blah blah. And you know, after sitting down and talking with Josh about it, we decided that that was probably the most the smartest thing for us to do at this point. You know, I do want kids in a few years, and I want to make sure that I'm financially stable for them, but at the same time, if I wait any longer to have this plastic surgery, I'm probably going to wait until I have kids, and then I won't end up spending the money, mostly because that's just my personality, and I'll find 500 other things that I need to spend the money on. So now is the time for me to do it, even if that means that after I have kids the tummy tuck is ruined. But honestly, with how I look now, anything is better than this, and children might wreck me a bit, but I'm certainly not going to have this hanging thing and whatever else is going on after I have a kid or two. So that wasn't my concern. Having a mommy belly wasn't my concern. Having all this loose skin is a problem. So that's my big thing. So I had my pre-op appointment for my surgeon. He does it a month ahead of time because they collect payment, which was painful, and then go over everything and make sure that they have everything they need for you. At least you have time to get like your pre-op clearance and stuff for surgery. So I have to go see my primary care physician, and I have to go get a EKG because I had bariatric surgery. They make all of their bariatric patients go because I want to make sure that their hearts are healthy enough to handle the anesthesia. So I can appreciate that, although it's kind of annoying because I never had heart problems, so, and I'm so young. I mean, I get it for maybe, whatever. I mean, I was super morbidly obese, so I can't go there. But I felt really good about the pre-op visit. He went over everything again. He clarified some things for me. He said he's doing a lot of liposuction on me, like a lot. And that's exactly how he sees, like, I'm doing a lot of liposuction. So I'm gonna look like I got the shit kicked out of me, everybody. He said that he'll do it in my flank, he'll do it on my sides, and in my stomach to make sure that I get the flattest and best contour possible. So that's cool. I told him to suck it all out. Like, whatever's left, just suck it all out. But he said that he'll put 2 drains in my stomach, and he'll take out drain 1 at day 7 and drain 2 at day 10, barring everything looks good with the drains. My belly button will be an internal incision. There will be no external stitches, and they'll all be dissolvable. He said you won't even be able to tell that there are stitches in my belly button from the get-go. He did warn me that I won't be taking my binder off until my first pre-op visit with him, which is day 7, day 5 or 7, depending on surgery schedule. And at that point he warned me that I'm gonna look absolutely terrible just because of scarring and like just all the binding and the swelling and stuff. So he said that a lot of patients have problems when they first see themselves, but I told him that Lauren Dayton has prepared me quite well, along with Patty and Tanya. Everybody's kind of given me a pretty clear idea of what to expect afterwards, so I appreciate that. And I'm sure Amy will be willing to share everything with me as she goes through the process in the next few weeks. He gave me Percocet for pain. I already have that prescription, an antibiotic for afterward, and Zofran for my nausea because I get really sick after anesthesia. He also the office gave me a regimen of vitamins, but I talked to him about it, and he said because I take good high quality vitamins and I'm on a good strict schedule with that he doesn't think that I need to switch over to their vitamins. They did give me bromelain, which I was interested in taking because it's supposed to help with inflammation, but I'm allergic to pineapple, and bromelain is a derivative of pineapple, so I can't take it because I'll die. So that's out for me. I had somebody recommend some kind of herb and garlic beforehand, but that seemed a little too old wivesy for me. So yeah, guys, it's getting there. I mean, I'm in now August. I'm having surgery in August. I'm 24 days away from having my plastic surgery. I'm nervous. I haven't been preparing like I should be. I've been super flippant about pretty much everything having to do with this surgery, mostly because I think it's a defense mechanism. It's the first crazy surgery I've ever had. I mean, I've had 3 knee surgeries, gallbladder removal, my weight loss surgery, but this one is a huge, I mean, I'm going to have incisions around my nipples, down my breasts, under my breasts. I'm going to have the incision across my stomach. And I'd like to say that I'm not being a big baby about it, but I totally am. I did ask him about the recliner. He said don't get it because he didn't think I'd need it. So we'll see if he eats my word that. But I didn't get it because honestly, if he says he doesn't think I need it, then I'm gonna go with what my surgeon says. I did get some comfy like reading pillow for this bed because this is where I'll be staying. This is our guest bedroom. New filming location, everybody. And then I got like one of those table things, lap tables with like legs, so nothing lays on my stomach because I have to work from home for 2 weeks. I'll be taking an entire week off. I'll be off from Thursday through that following week, and then I will work from home after that for 2 weeks, and then we'll play it by ear to see how I'm feeling. And then, yeah, I also got some cute little t-shirt dresses to wear. This is one of them. Just because I want to, because it's going to be warm still, and they said to wear loose fit clothing, and if I don't have to wear pants, it's probably the better option for me. So that's about it. I'm definitely nervous though. And I'm not really looking forward to the anesthesia as per usual. I have really bad issues with it, but I'm going to do my best and hopefully get through it. Because my surgery is at 7 o'clock in the morning, Josh and I are staying in the city the night before, and then I have to be at the doctor's office at 6:15 in the morning for my 7 o'clock surgery. He said it'll take 3.5 hours, and then they'll keep me until I'm able to get out and get back to the hotel room. My surgeon gave me his personal cell phone number and called me from it while we were in the office and said, look, if you need me for anything for whatever reason, you call or text me and I will answer. So I have that, which is good. So if there's any issues while I'm in New York or once I get home, I can reach him pretty easily and talk to him directly instead of like an answering service, which I really appreciate. So that was awesome. But it's going to be a rough go, guys. It's going to be a rough go. So, I'm trying to muster some excitement about this, but I'm really not excited. So, part of it's... Oh, this is beautiful. Maybe I should get my arms done. I don't give a shit. Sorry. I didn't write notes, and this is like the third time I've made this video for a variety of reasons, but I understand how lucky I am. I understand that I'm lucky enough to be able to have this surgery and afford it and have this option available to me, and I appreciate it, but it is still terrifying to me. I mean, it's still an elective surgery. I don't have to have the surgery. I needed to have my knee surgery and my gallbladder surgery and my bariatric surgery. I could warrant that, but this one is just, as much as I paint it as reconstructive and as much as we all know how important it is, I could live without it. And I think that's the part that's freaking me out. Like, I'm willingly dealing with this. So I guess I'm struggling with that portion of it. And it's a lot of money. It's a lot of money. But I'm already signed, sealed, and delivered on that, so there's no turning back now. And I am excited to get this done and over with and move on. I think that's the biggest thing, is move on and actually be able to see the results of working out, and really reap the benefits of all the hard work that I've done. I think that's it. I'm young, and I deserve to have the rockin' body that I've worked so hard to have, so. Okay, guys, I'm probably not, I'd like to say that I'm going to make another video between now and my surgery, but I probably won't. I'll probably do one more, like, right before surgery about, like, any prep that I've done. If anybody has any questions, I'll answer those. And then I'll update on Facebook after surgery, because I tend to be kind of a wreck for the first 24 hours afterwards. And then I'll make a follow-up video every few days, like kind of like Lauren did, where I just talk about things. And then when I can show you my incisions, I will. And I'll keep you up to date for at least the first 3 weeks while I'm at home, because I'll be able to easily do that. So yeah, if anybody has any questions or wants to say anything, feel free to leave a comment below. If you add me on Facebook, that's fine. Just let me know where you found me below. Like, just let me know that you're going to do it in a message below. Or privately message me on Facebook and just say, hey, I watched your YouTube videos, I want to follow your progress, and that's fine. But I've had a lot of creepers, especially since WLSFA for some reason. I just, if I don't know you, I'm getting a little hesitant on adding you just because of my current job, and I'm very public about it, and I want to make sure that the people that are on my Facebook are there for the right reasons and they're not trying to sell me something or whatever. So I'm just paranoid lately. So yeah, feel free to add me, but just let me know who you are, just so I know that you found me here, and I'll be in touch soon. So 25 days, 24 days, guys, it's coming. So bye.